Another clinical challenge we can have is understanding how best to use immune herbs. And it's fair to say there's a reasonable amount of trepidation and misunderstanding and hesitancy about using immune herbs in certain circumstances, certain clinical circumstances. I fundamentally support the belief that in the main, and I will tell you an exception, our immune herbs are quite benign. And that's because they either function as immune tonics, so you've got someone who's depleted and their immune system's not reacting as well to challenges, and you need to improve the functioning of their immune system, but it's associated with low energy and debility. So that's where you use immune tonics, and astragalus is probably one of the key ones there. But tinospora, I believe, also comes into that category. So you've got these immune tonic herbs that are also adaptogenic-like as well. And indeed, the adaptogens, many of them, I think, also function as immune tonics, like Siberian ginseng in particular. So they're your immune tonics. So you're using that when a person's depleted. You don't necessarily use them in an acute state where someone's fighting off an infection, but that doesn't mean to say they're going to do great harm if you mistakenly prescribe them in those circumstances. I mean, it's not that dangerous, but generally you would avoid those immune tonics in an acute scenario. Then we have what I might call immune enhancers, and a subset of that is immune modulators. Now, why am I using that language? Well, because the immune system has two arms to it. It has an innate immediate response arm, innate immunity, and it has an adaptive aspect to it, where the response leads to some sort of learnt adaptive behavior, like the production of antibodies, for example, or the development of T cells that are sensitized to a particular part of a pathogen. So innate and adaptive. So the reason why we use the term immune modulator is because a lot of herbs more tend to act on the innate side, and that modulates the immune response in a couple of ways. The first thing is where you have, for example, a myriad of pathogens confusing the immune system, and it might be driving inappropriate inflammation. If you, in a sense, with these herbs, immune enhancing herbs, sharpen the focus of the immune system, then you'll settle down the adaptive side. So that's where the modulation comes in. I honestly don't think, with one exception, and that's a herb that I put into immunostimulant, I honestly don't think that herbs will unnecessarily or inappropriately stimulate the adaptive side of the immune system. I think they mainly help the innate side, and by helping the innate side, you get the appropriate response from the adaptive side. And if that response is something that needs to respond to a pathogen, then you've got immune enhancement. But if that response is something, as in the case of overactive immune system in autoimmune disease, that often means that you actually settle down the adaptive side of the immune system. And then we come to the immunostimulants. And the one herb I put in that category is phytolacca or pokeroot. And it does have some uses, but be careful with it because it probably might cause adverse effects if used inappropriately. But it can be quite handy where you really want to rev up, especially that adaptive side of the immune response. Now, there's one thing I haven't mentioned, and that's medicinal mushrooms. So where do they fit in? They probably fit into the immune tonic category and the immune enhancing category. So you can use them very broadly in that way. And in a sense, they're very versatile and safe to use. So let's talk now about this issue of, someone has autoimmune disease. Do I give them echinacea root? Do I give them antigraphis? Well, I hope I was able to explain by this innate versus adaptive immunity that yes, you can. And particularly as we know in autoimmune disease, often there's a role of stealth pathogens, feeding inappropriate inflammation in the immune system. So by enhancing the innate immune response with echinacea root, antigraphis, or whatever, you will hopefully help the immune system eliminate those stealth pathogens and then calm down its inappropriate adaptive immune response to self-tissue, which is autoimmunity. But it's quite interesting now that we look at the case of antigraphis, we actually have clinical trials where it has not only been shown to be safe in people with autoimmune diseases, and the two particular autoimmune diseases are inflammatory bowel disease and multiple sclerosis. Just recently, there was a clinical trial, a small clinical trial. Now, they used pure antigrapholide, not the whole herb. But in that clinical trial, they basically showed that the progression of MS was modified and brain atrophy was possibly less. So you're seeing improvement in clinical outcomes that are related to autoimmunity. So I hope, for example, those clinical trials on antigraphis reassure you that you can certainly give immune herbs to patients with autoimmune disease. In fact, in my opinion, they're absolutely fundamental to the role you can play in helping the patient get out of that situation where their immune system is attacking their own tissue.